Hi, I'm Dr. Ina Hughes from the Pediatric Epilepsy Program at University of Rochester. And today I'm going to talk with you about bringing seizures to school and all of the things that we need to do to help our kids be safe and have a really successful school year. Of course, our wonderful program is brought to you by EPI with support from the Epilepsy Alliance of America and Neurelis, as well as our team here at the University of Rochester Medical Center. So one of the reasons this is so incredibly important is epilepsy is fantastically common. And while an individual in a school may have an individual school may only have one or two kids with epilepsy in it, almost every school across the country is going to have kids with epilepsy in it at some point because epilepsy is a childhood onset disease for many people. And so in order to help our kids to have the best experience possible of life, we want to make sure that they have a really awesome school experience. And so this is the time of year for us to be prepping for a new school year and program year for our kids and want to talk about the different aspects of how best to do that. One of the things that we think about when we're trying to figure out how can we best plan for things are what are other people worried about for our kids? Many people worry that seizures can injure the people that are experiencing them. They worry that the school, the people who are at the school, bystanders, that they might do something wrong that could harm the child. And unfortunately, in some cases for schools, they worry about things like putting schools and teachers at liability. And then just from a practical aspect, seizures disrupt the day. They interfere with learning in the moment that you're having them for many people. They disrupt the school day for the child who may need time to recover. They're surprising and unexpected for the people around the child and change the way the day is going to flow. And sometimes people worry things like if someone is irritable or aggressive or having a bad day and being retired, that might have been a seizure that they missed and that they should have done something to help. What is the reality? Most of our kids with epilepsy, they can and they absolutely should participate in absolutely everything to do with school, and they can do that safely, including sports and gym and other activities. As long as there's appropriate supervision, people know what they're looking for, they know how to help our kids and recognize when they need to help our kids. And so the best thing that we can do is try to combat a lot of that fear with good and excellent information. And we have lots of really great partners that help us to do that. The more education that we can give to people, not only do we help our own kids that are in the school system, but we can help those schools to learn so that when another kid comes in, they already know what to do, and they can help to perpetuate that good education and good experience down the line. So what are some of the things that we need to teach them about our kids with epilepsy? So many students with epilepsy may need to go to the school nurse for medication. Sometimes kids take medications multiple times during the day. Sometimes they need to go to the nurse for those things. If they feel a seizure coming on, they may need to go to the nurse for medication, or they may have seizure activity during the day and may need a medication plan for that. Sometimes our kids, particularly during times of medication changes, can be experiencing side effects of their medication. Sometimes they may be tired or moody or less attentive, and it's worthwhile for people to know that so they can help us to look for those side effects so that we as physicians can learn about them and improve them, and that families and schools know how to kind of handle that time if a kid is experiencing those symptoms. Sometimes, even when we do everything right and meds are in the right place, and seizures still can occur, and kids can end up missing class time due to seizures. Sometimes they need to come into the hospital to do long-term video EEG monitoring. Sometimes they need to come and see us in clinic, and those things need to be accounted for in their school plan. Many types of epilepsy are often associated with learning difficulties or behavioral differences, differences in development, and those things need to be assessed and managed as well. Some kids will need to have seating accommodations so that teachers can watch for more subtle versions of seizures. Sometimes kids actually benefit from having a support person, like an aide in the classroom with the teacher, so that the teacher doesn't have to be on high alert and always watching an individual kid, that there's always someone who is given that role to help with seizure safety and monitoring or redirection, or helping someone after they've had a seizure to just feel more comfortable. And then the kids themselves sometimes feel embarrassed or disrupted in their school day about their condition, and they would always benefit from psychosocial support. So those are kind of the things that we put in place so we can think about how to best support our kids in that transition to the school year. So how do we meet these needs? So many of them can actually be built into things like a 504 plan for kids who don't need special education services. And for kids who do need special education services, we have something called an individualized education plan that builds in all of these can build in all of these features, as well as their school needs and specific to their education, and things like PTOT and speech therapies. And then every kid with epilepsy, and quite honestly, every adult with epilepsy, also would really benefit from having an active seizure action plan. So what can parents do? At the beginning of the school year, talk with the school, teachers, whoever is appropriate from the school nursing standpoint, and share what happens when your child has a seizure. Work with your provider, who would be somebody like me, your neurologist, your pediatrician, to make sure that your kid has an active seizure action plan. And make sure that that seizure action plan is part of their IEP or a 504 education plan, or is disseminated in a consistent way across the people who are going to care for that child over the course of the school day. And that includes, for instance, before and after school programs, any daycare programs, things like that. Ensure that the people who work with the child regularly are familiar with the plan and are prepared to respond in the event of an emergency, and that they know what those emergencies look like and that they're prepared for them so that they can feel comfortable with it when it or if it should ever occur. Thankfully, most seizures aren't life-threatening, but we do know that when seizures last for longer than 3 to 5 minutes, or the child is having difficulty breathing or isn't recovering from a seizure, that people should know that they have the ability to call for backup using 911 if they need to. For many of our kids, seizures are short, they recover on their own, they don't need 911, they don't need special medications for most seizures, but they may be tired or disoriented or confused after the seizure. Sometimes they can even get aggressive or combative, and that can last for a little bit, and they need to know how to handle if that occurs with the child. Many times the answer is you call the parent and the child goes home until they can recover, but some kids will only need a few minutes, and maybe that just needs to be a safe place or a safe an adult for them to be with until they can recover, and that needs to be planned for. So we would make safety plans for students to have recovery spaces, to go to the school nurse to lie down if possible, or to go home if they need to with convulsive or longer seizure events. And then for some kids, they're not at their best around the time of having a seizure, and they may need to have built into educational plans or just their school plan an ability to have a little bit of extra time if they've had a seizure around the time of a test, or to make up missed classwork or assignments from things like clinic visits and workup for their epilepsy and things like that. And those are things that we can plan ahead for, so it's not a surprise from the standpoint of school. They're like, oh, you're asking for this accommodation somewhere in the middle or after something has happened. If we plan ahead for that and they know that's a possibility, they're often far more receptive to making sure that a kid has access to those services. Importantly, if you find out in the middle of the year that someone needs access to those services, you can still request them, even if it's in the middle of the year. They still need to grant access to it because epilepsy is an Americans with Disabilities Act, an ADA approved diagnosis that provides services for kids and adults with epilepsy. So the other really big thing, in addition to working on kind of the school-based and educational supports, is making sure that everybody who has epilepsy has an active seizure action plan. And a seizure action plan is actually a relatively complicated document, mostly just in the sense that you want to make sure you explain everything about someone's epilepsy to a person who has probably never seen a seizure before. So think about what are the components of a seizure action plan. They can look lots of different ways. They can look like a letter from your neurologist. I'm going to show you a couple that are standardized seizure action plans that are available through seizureactionplans.org, as well as the Epilepsy Alliance of America. So things that are really important. Who is the kid and what are their needs and characteristics? What do their seizures look like? Are there triggers that people should be aware or to avoid, or recognize that a kid may be more susceptible to having a seizure if they're seen? What do people need to do to keep a kid safe during a seizure? When do they need to use the rescue medication? How much and what are the rules for when it can be used? When do they need to call EMS or send a kid to the hospital? And what are the safety precautions associated with a specific child's epilepsy? There's a lot of really great support for creating a seizure action plan, including this really great group called seizureactionplans.org that is working to make sure that every kid who has epilepsy, and quite honestly, every adult that has epilepsy, has an active seizure action plan to help them to have the support that they need during that time when they're not having, when they're having a seizure and not able to have their own safety guaranteed for themselves. All right, so let's talk about the seizure action plan kind of format. This is a pre-created seizure action plan by seizureactionplans.org and the Seizure Action Plan Coalition. So what do we need to know? Who is the kid and what are their needs and characteristics? So who are we talking about? Who are their parents and who should we let know if they've had a seizure or something is going on? What are their diagnoses and what medications and treatments do they currently have? That's all background information. And if you want to add height and weight, that's even better, because if they ever get into a situation where EMS needs to be called, those are things that EMS really loves to know, because it helps them with planning additional medication if they ever need it. What does a child's seizures look like? What triggers should they be aware of and to avoid? So sometimes you can just make that as a narrative. You can say, before a seizure emergency occurs, we see these kinds of things happen with a child, like they pause and they stare, or they get irritable or confused, or they can explain that it occurs on one side of their body or the other. Those are the kind of things that can be really helpful for people to both understand what it is when a seizure occurs, but to also recognize what isn't a seizure for kids who may have more complex movement disorders or other things like non-epileptic attacks. Those things are all really important to put into the seizure action plan as well. So having seizure type information, which is how do you describe it? What do you see when it occurs? How long does it usually last? How often do those seizures occur? And any additional information that you can give is always helpful to people to better understand how to recognize an event and to intervene when it's appropriate. So then what do we need to do to keep those kids safe when they do have a seizure? Some seizure action plans will already have kind of basic first aid procedures that are described. Most common ones that we think about are helping people to the ground, helping them to be safe and remain on their side. Don't restrain people, don't put things in their mouth, allow them to have their seizure without trying to prevent them from shaking, making sure that they are kept in a safe location until they can fully recover. And recognizing when it's time to call 911. For instance, if someone is turning blue for a prolonged period of time, they aren't starting to breathe again, the seizure isn't stopping, they've had an injury. And just determining exactly when those rules are for calling 911 or contacting the school nurse. So each of those things you would want to have described. So now what do we do about for seizure rescue medication? So for anyone who's having a seizure lasting longer than about 3 to 5 minutes, they may require a medication to help to make that seizure stop if it isn't stopping on their own. And thankfully, there are a lot of different options that are available. For children younger than the age of 6 years old, right now, the primary rescue medication available is something called diazepam rectal gel, or Diastat. And this medication is weight-based and is often, all of these are prescribed by their pediatrician, their neurologist, their epileptologist, and each of them will have specific rules about when it would be appropriate to give that to a kid. And so all of that information, which medicine, how much medicine, when to give, are all things that need to be included in the seizure action plan. For children over the age of 6, there is an intranasal diazepam that is available, that is referred to by the brand name Valtoco. For children over the age of 12, there is also a different type of medicine of midazolam intranasal solution, which is the brand name Nasolam. There are other options that exist as well, and choice of seizure action plan and choice of rescue med are often very specific to the patient and are decided with a combination of work with the patient and their doctors. But every kid who has a seizure that is prolonged should be able to have a rescue medication to help to stop it. And then one of the things that's important is, are there any safety precautions associated with a specific child's epilepsy? It is very rare, but there are some patients who may require things like oxygen after a seizure, or may require some additional supports. They may need to have time to recover in a specific type of way, or may need to have a snack or something after a seizure occurs. And those would be things that we would consider. Maybe on a day when they have a seizure, that's the day that they don't go to a specific school sport or activity. We also want to make sure that that is always a signed and dated thing. And you also want to consider what's the best way to communicate. So if you're giving information to a school nursing office, for instance, they may have their own specific forms and rules for how to communicate that information. If you're giving it to, for instance, sports team folks or people who may not be necessarily medically oriented, like a school nurse, maybe something simple like this one created by the Epilepsy Alliance of America, where a seizure action plan actually has a drawing and plan for what someone needs to do with pictures and with more simplified instructions may be helpful and important as well. So ask your doctor and think about who all needs to have access to information about a rescue plan, and how would we best communicate that to people. So one of the things that's really important about a seizure action plan, we tend to write them around this time of year. Quite honestly, we write about 1,000 seizure action plans for our patients here at URMC every year. But despite that, one of the things that's important is we need to update it fairly frequently. It should be a living document that changes as the kid grows and changes. If there are new seizure types or if certain seizure types are now fantastically rare, we should be updating those. Kids' seizure frequencies can change a lot. How long seizures last can change. What medications they're on certainly do change over time. And then making sure that we're fitting school or specific program specific forms, and we may even need specific seizure action plans in different places depending on what kids are doing in those places. So very often when we have a kid with epilepsy, families have lots and lots of questions, not just associated with the seizure action plan, but just associated with life in general. So one of the big questions is, can my kids with epilepsy go to school? Simplest answer is absolutely. The Americans with Disabilities Act and the IDEA education law specifically address that kids with seizures can go to school and that they can have specific accommodations provided to them that make it safe and appropriate for them to be in that school setting. Can kids go on field trips? Absolutely. Does the school nurse need to go? No. Do parents need to go? No. That's why we have a seizure action plan. Very often will help to explain what to do if kids are out of the school setting or the school nurse isn't available or the seizure med may not be available because there isn't someone to specifically transport it. That should be built into seizure action plans to allow for that flexibility so that kids can do the same things. Kids with epilepsy can do the same thing that all the other kids in school can do. Can kids swim? Yes, and to the best of their ability, but with appropriate supervision. You want to make sure that if kids are going to be swimming, if they have active seizures, that there's someone who can recognize their seizure and who can rescue them if they are going swimming. Drive, yes, to the best of their ability and per state's individual requirement. Here in New York State, just a reminder, teens need to be at least 16 years old and they have to be at least 1 year fully seizure free before they can start to drive. If those two things are met and they are capable of driving, then there's no reason why they shouldn't be able to do driver's education or other aspects of eventually getting to learn how to drive. Eventually, you'll get asked questions like, can my kid with epilepsy live away from home? And the answer is yes, if they are otherwise ready for that, and we plan for their needs appropriately and give them the supports that they need to make sure that that can happen well. So as always, we want to make sure that our folks living with epilepsy can live the best quality of life possible, and that everyone that is part of their lives who can impact them during the course of a seizure knows what to look for, knows what to do, and feels empowered to do the right things. So please let us know if you have any questions. And of course, thank you to our sponsors and to our wonderful team at EPI.